It's 8:30 now here on a Wednesday. We've got a special guest in studio. She's not here. She's here a lot, but she's not here at 8:30 a lot. Dr. April Ritz joins us. Good morning.
Good morning. It feels good to be here in the morning. Switch it up a little bit.
That's right. You're here a lot of times at 12:30 with us on the cafe in the deli, but we're glad to have you on the morning show once.
Thank you.
Yeah, so what's going on at Effingham Pelvic Health and Wellness?
Yeah, so I just wanted to talk about kind of go back to the basics of our clinic and what we see and some common complaints we hear. So I'm Dr. April Ritz. I am a pelvic floor physical therapist certified in pelvic rehab for both men, women, and kids. And I'm also certified in obstetric care, so working with moms during pregnancy and postpartum. And we also have Dr. Kyla Burton, who treats men and women. She does not see kids, but also all the same issues. Mm-hmm. So we are located on the corner of Evergreen and 4th. So we have the blue roof and the signs out front that we try to keep some humor in the day. Mm-hmm. But we are a clinic that primarily specializes in treating anything related in the pelvic region. So whether this is low back pain, SI joint pain, which is also kind of left or right sided low back, hip pain, and any pelvic floor dysfunction.
So back pain, something a lot of us deal with periodically, and you're telling me there are a lot of different causes.
Yeah, so we have patients come in all the time and say, I have seen this person, I've seen this doctor, I've been there for that. And they're like, my back is not getting better. And we're like, well, did you know your pelvic floor connects to your tailbone, which is part of the back? So the tailbone is the very bottom part of the spine. So we have the tailbone, then the sacrum, then like the lumbar spine. And those pelvic floor muscles have a connection there. So whether those pelvic floor muscles are too tight or too weak, that can lead to issues with back pain, as well as a lot of people say they have back pain, but it's actually their SI joint is off alignment. So we see that in the clinic pretty frequently too. And those are both things that we specialize in treating.
Yeah, I don't think people just realize that. They don't associate the pelvic area with the back or other things too that can, that the pelvic floor and all that is connected to.
Yeah, and chiropractors and like general physical therapists are great with helping with back pain too. But I always say if you're not getting full resolution of your symptoms, the pelvic floor is a huge area that is missed in treating conditions. And really from like mid thigh up to like mid back, pelvic floor influences that area.
April, is it fair to say that almost everything can be helped by treatment? I get the feeling that a lot of folks think, well, it's my back. It is what it is. But you're telling me that really you can help it.
Yes, if people are willing, here's the thing. If people are willing to put in the time and effort to do exercises and seek out care, some people honestly aren't ready for help. Some people honestly like to complain about their pain or just want a pill to fix their issue. And that if that's you, our clinic is not meant for you. Our clinic is for those people who really want to get back to feeling better and are willing to put in the time and energy to wake up in the morning and do a few exercises in the evening. And I'm not saying we're going to take an hour out of your day to do exercises. We like to make it realistic. We work with a lot of postpartum moms who have little babies. It's hard to get exercise in that time frame. So we like to make it part of their daily activities. Like when you're changing the baby's diaper, you can be doing these few minimal like core and back exercises, just changing a diaper. When you're in the shower, you can be thinking about doing this. When you're brushing your teeth, you can do some hip exercises when you're doing that. Like add it into your daily activity so it's not taking extra time because we are all busy.
Yeah.
Well, I think it's a good thing that you came in this morning and kind of said we're going to go back to basics because you've reminded me of the wide variety of things that you cover and not just a specific item or two.
Yeah, so I have a long list and we can go through these, and then each of these individually could be a whole other 10 minutes on the radio talking about it. But so something we see frequently in the clinic is pelvic pain, and we treat a lot of people with sexual dysfunction. So pain just throughout the day, abdominal pain too, pain with sitting, tailbone pain, certain conditions like interstitial cystitis, endometriosis, PCOS, pain after standing on their feet for long periods of time, just like a heaviness in the pelvic floor. And then also, pain with sexual intimacy. And actually talking about that, I wanted to throw in that tonight at Sacred Heart Church, Sacred Heart's sponsoring a talk with a lady from Louisiana. She's going to Zoom in, and then I'm going to talk before and after her. And one of the topics I'm covering is sexual dysfunction, because it's an area that is not discussed, and people go with all these issues, and it affects marriages. So some of the topics I'll be talking about regarding sexual dysfunction is like women whose pelvic floor muscles are too tight and too painful, where they can't even have sexual intimacy with their spouse. And then also men with erectile dysfunction. Both of those issues are something that can be treated, and physical therapy can help with those. So that event tonight is 6:30 to 8:30 at Sacred Heart in the narthex, like right off the church. And it's a free event. So if anybody's interested in coming and learning about, it's an event geared for women, but sexual dysfunction, and then also natural family planning and fertility awareness methods. So that's something I also teach in our clinic, but teaching women how to look at their biomarkers, so their body temperature, cervical mucus, luteinizing hormone, and then tracking their periods and when they're fertile and infertile. That can tell us a lot about overall health. Sometimes people are having painful periods and issues with their cycle, and they have no idea where to start. The place to start is tracking your cycles using a method like Creighton or Marquette, and learning like what's going on. So those are topics that we'll be talking about tonight, and it is a free class for anybody in the public. You don't have to be Catholic to come to the event.
I think it's cool that this is going on at the church because, church, sex, there
Yes.
seems to be this gulf fix between them, but it's part of life.
Yeah, and part of the things we'll be talking about tonight is I am part of the parish council at Sacred Heart, and sex is holy. Sex is like created to be good, and often from a young age we're heard like sex is bad, and there's the whole purity culture, which I understand where that's coming from, but to be educating people that sex is good when it's used in the right ways and in the right content or context. So we'll be talking about that tonight. So yeah, I'm really excited that the church is letting us come in and talk about these important things that often are very hush-hush, and people don't know who to turn to when they're having issues.
Yeah. And again, 6:30 tonight.
6:30 at Sacred Heart.
All right. Very good.
Yes.
Very good. And you guys do a whole lot of other things too there at talking about the pelvic floor and all that that's associated with a lot of different things.
Yeah. So some of the other conditions we treat, we talked about tailbone pain, abdominal pain, especially with my patients with constipation or pelvic pain. There's a lot of abdominal tension that they don't even realize. And we go to work on their abdomen and just figure out where there's like tension. And they're like, oh, I didn't realize that hurt. And we're like, it's all connected. I see this a lot with kids too. Unfortunately, I had a child in last week, severe abdominal bloating, pain, severe constipation. And I'm like, we can help this kid so much. And they have been to GI doctors, pediatricians, all this, and they just don't know where to go to get help. They're told, take Miralax. And for some kids that doesn't cut it. Like they need more specific training by a pelvic floor therapist who's trained in pediatrics. So we also see kids with bedwetting issues, bowel leakage, urinary leakage. Unfortunately, I've had kids cry in my clinic because they're so embarrassed when they go to school and are dealing with these issues. And with school starting again, some kids are getting bullied, made fun of. So I have a passion for helping these kids so they're not bullied and they can go to school and feel comfortable and confident using the bathrooms at school.
Very good. Very good. And what else do you guys do there then?
Yeah. What else? Urinary leakage, bowel leakage, overactive bladder is a huge one. Urinary urgency. We've been seeing a lot of men and women in the clinic for urgency. It's affecting their jobs, whether they're driving on the road and they're having to literally pee in a cup driving, or pull over to the side of the road and pee on the side of the road because they can't make it to a bathroom in time, or else they're going to have a leak. We've had people in the clinic that are in the healthcare field and they're having to go to the bathroom all the time. And it's impacting their surgeries and things like that they're having to do. Another condition is IBS, so irritable bowel syndrome. And we partner with another person in town for nutrition regarding that. Something Kyle and I both love seeing is working with pregnant women and postpartum women, whether there's pain or there's no pain, and just getting them back to optimal condition. So working on pelvic floor, whether there's tension that they don't even realize, prolapse issues, weakness, all women going through pregnancy and postpartum have a weak core, and getting those muscles firing again properly to help reduce back pain and being able to lift their kids. We also see men for prostate issues. So men, before having a prostate surgery, or if they have cancer, helping really anybody, women and men, with any cancer, ovarian, uterine, colorectal, things like that, because typically when they go through chemo and radiation in that area, it's going to impact the tissue and the muscles, and helping them recover after those surgeries. And then also with prolapse and hysterectomies, we really encourage pelvic floor physical therapy before having a prolapse surgery, because sometimes surgeries can be avoided just by learning how to use those muscles properly, and addressing the muscles that are underlying, kind of holding up those organs. Some people do need prolapse surgery, and then we see them afterwards to help improve their muscle strength or reduce their muscle tone, so the surgery outcomes are better, because those surgeries only last so long. And if people go back to their constipation and lifting heavy weights, with breath holding or exercise that's not appropriate, they can make those surgeries fail because they're not addressing the underlying issue, what led them there in the first place.
Yeah, very good, very good. Now, when can we come see you?
Anytime. So we are open Monday through Thursday, and we see patients from 7 a.m. to 5 p.m.
Okay.
So we can typically get people in within 1 week if they have a hard schedule that we need to work around. Typically 2 to 3 weeks we can get them in. But yeah, just give our office a call. Our number is 217-705-5077. We're also on social media: Facebook, Effingham Pelvic Health, Instagram, I think it's Effingham Pelvic PT on Instagram, and then our website's effinghampelvichealth.com, and you can read our information on there and get a lot of your questions answered, or just call us, and Lori would be more than happy to talk to you about your symptoms and how we can help with those.
Very good. Well, thanks for coming in today and informing us. You every time you come in, we learn something.
Good. That's my role. Is one of the things for our clinic. One of our values is just educating the community and letting people know that there's help for them. So.
All right. Very good. Thank you very much again for coming in today.
Thanks.
It's Dr. April Ritz. Appreciate her joining us from Effingham.